Good afternoon. My name is Carolyn White and I'm the Vice Chair of Nottinghamshire Healthcare Trust. And this afternoon I have chaired the board on behalf of Paul Devlin, who unfortunately wasn't able to be with us today. Today the board has focused really heavily on our financial position. It would be fair to say that both nationally and locally we're entering into a really difficult period in terms of NHS finances. The board has received a lot of information around our current position and we do have some very challenging times ahead of us. I think it would be fair to say that we will be looking to all of you to help and support us in making those decisions in the weeks and months ahead. The Council of Governors is another important aspect of our organisational governance. The Council, as part of the senior decision-making structure, holds the non-executive directors to account in terms of delivery of the Trust strategy. And we've heard today as well that Jim Aliander has been re-elected for a further term as the lead governor, which we're all delighted about. We've also covered a broad range of other issues, as you might expect. Importantly, we looked at the annual safeguarding report, which was presented by Di Hull, our new chief nurse. Di has emphasised the excellent work that has been going on across the organisation, and I think we were all quite surprised to hear how many referrals, both in children's services and adult services have been made. It's a really important aspect of the work, and I'm really grateful to all of you for making sure that our patients are safe. As part of the board reporting process, we hear from all of the subcommittees of the board, our Finance Committee, our People Committee and our Quality Committee. Today we received some really important reports on safeguarding, and we were really quite surprised, I think, to hear how many referrals are made across the organisation annually in terms of both adult safeguarding and children's safeguarding. And I want to say thank you to all of you for making sure that our patients are kept safe every day by doing that. In terms of our people report, Jen Guyver reported on the Refresh People Plan, and again some really important work that's going on there. We've worked really hard to try to recruit to the vacancies across the organisation and to reduce the number of agency staff and bank staff that we're reliant on, because we recognise that that is the best way to make sure that we provide a good quality and consistently good service for our patients. As part of the Chief Executive's report, IFTI confirmed that Sue Elcock, our Medical Director, has been appointed as his formal deputy for the forthcoming year. And we all wish Sue very best in that new role for her. One of the important reports that we received today has been written by Healthwatch, who have undertaken a piece of research across the organisation. They're looking specifically at patient experience, and whilst there were some really good elements of practice that they've highlighted there are also lots of areas where we can see that we can improve services. We're looking forward to reviewing that report in detail over the coming weeks and receiving our action plan back at a future board, probably February-March time, when we've been able to agree actions going forwards. I think it would be fair to say that today's been a really challenging day for us at the board. We always want to make sure that we have a balance between ensuring that we can resource services adequately and that we are delivering good quality services whilst we're looking after our staff. Sometimes we know we don't always get that right, but it's important that we keep on challenging ourselves and making sure that at the end of the day you guys can all do your job in the best possible way and that our patients get the best possible service that we can deliver. Thank you.